future nurses, isolation precaution questions do not have to be nerve-wracking, so come closer, let's break it down. And I also have endless review on isolation precautions. Go review that at Scrub and Spoon. Now let's go. The first isolation precaution we go into is standard precaution. Now this is a universal precaution, that is, it is used for all patients regardless of their diagnosis. Standard precautions include hand hygiene, that is, washing of your hands before and after patient contact. Next, you have to put on your gloves if you are touching blood or bodily fluids. And the next one is you have to put on your mask and face shield if there is risk of splash. And also remember to clean equipment like blood pressure cuff, right, a stethoscope in between patient use, right? So always use standard precaution as the baseline. Now the next one is contact precautions. This is used for infection spread by direct or indirect contact. PPE you need for contact precautions is your gloves and your gown, but you may also use your mask and face shield if there is risk of something splashing on you. But the basic PPE for contact precaution is your gown and your glove. Now, infections that require contact precautions includes MRSA, C. diff. Remember with C. diff, after taking off your gloves, you still have to do your hand hygiene, okay? VRE, RSV. This is respiratory syncytial virus. Also remember with RSV, it involves contact precaution and droplet precautions, okay? Scabies and herpes simplex. Now remember with contact precaution, there should be dedicated equipment to the patient on contact precaution isolation. Equipment like blood pressure cuff, stethoscope. You have to dedicate it to them. Do not share it. Now the next one is droplet precautions. This is used for infection spread by large respiratory droplets. And the basic PPE need for droplet precaution is your surgical mask, your regular mask. If you will be within 3 to 6 feet of that person, you have to put on your surgical mask. And you have to put on your gloves and your gown if you will be in close contact with patients on droplet isolation, okay? And finally, you may need your face shield if there is any risk of anything splashing. Example of infections that we put on droplet precaution: influenza, mumps, rubella, pertussis, that is whooping cough. RSV, remember I told you it's also droplet and contact. And lastly, meningitis. Remember there's types of meningitis, viral meningitis, but this one is bacterial meningitis, will be put on droplet precautions. Now remember this, NCLEX tested. When your patient is on droplet precaution, isolation precaution, if they need to get out of their room, they need to put on the surgical mask. If they need to be transported out of their room, they need to put on the surgical mask, okay? And the very last one is airborne precautions. This is used for infections that spread via tiny droplets, which stay suspended in the air. Now, the major PPE you need for airborne precaution is your N95 respirator, your N95. You need that before you can go in. And also, patients on airborne precautions are put on in a negative pressure room. Also remember to put on your gloves and your gown if you are touching that patient. And lastly, like I've been mentioning, if there is any risk of splash, put on your face shield, okay? Now, infections that are put on in airborne precautions are TB, tuberculosis, measles, rubella. Remember, it's not rubella. This is rubella for airborne. Okay, rubella is for droplet precaution. Also chickenpox, which is varicella for airborne precaution. And lastly, shingles would also be put on airborne precaution. Also remember this, patients also wear surgical mask if they need to leave their room and be in the hallway, or if they need to be transported out of the hospitals, they need to put on their surgical mask and keep their room door closed at all time. They are put in negative pressure room and keep that room closed at all time. Thank you.